deliver on health care.
Joining me for reaction to the president's speech are two lawmakers who were front and center last night. Republican Congresswoman Shelley Moore Capito of West Virginia and Democratic Congressman Joe Sestak of Pennsylvania. Welcome to you two both. I know it's been a late night, so I appreciate you waking up so early with us. Congressman Capito, let me start with you. How did the president do last night? Did he reach across the aisle?
Well, I think he certainly put the issue front and center as it should be, and I think he mentioned more than several times that he wants to have a bipartisan bill where we have common agreement, and so I think he laid down the gauntlet to his leadership in Congress, and I hope that we do find those common grounds and pass the health reform that I think we all agree we need.
You know, Congressman Sestak, you and I have talked a lot about this. A lot of people view this as the Hail Mary pass for the president. There was a lot of sports analogies used in the lead up to this. Did he accomplish what he needed to accomplish to get health care reform passed?
I think he took a great step towards it in two ways. One is, I think he reached out to a skeptical and an understandably skeptical public and laid out the facts and tried to dispel rumors. Time will tell, but I think he was successful on that. Second, he finally stepped up to the plate and truly showed his leadership in putting his imprint upon what he really wanted to do with some details in this health care bill. I think he did reach out to the other side by speaking about issues of tort reform, where he reached out to the other side and talked about some taxes, user fees on high-end types of insurance policies. The issue here is, can there be enough give on both sides that we actually take care of the American, that he or she doesn't lose their health care plan? And we'll find out if the titans in Congress will step up to their own plate and make that happen in the days to come.
Congressman Capito, walking away from this, it became crystal clear. Your health care should not be impacted if you are happy with your health care. But when the president said he would not sign a bill that would add a dime to the deficit, a lot of people looked at that and said, is that reality? Is it possible? Did he justifiably walk through how we're going to afford health care reform?
Well, not to my satisfaction. I think if you look at $900 billion and everybody's going to keep their own health care, you're going to have other like mammograms and other things at no additional cost. There's going to be no taxes raised on the middle. It just defies a little bit. I'm not sure A equals B here. And so I guess the devil's in the details. I have some skepticism as well as to whether the cost savings that he put forward last night are actually going to, and he even mentioned this in his speech, are actually going to be able to carry the burden of that cost. And so I think these are things that we need to look at. As I found traveling through my district over the last several weeks, that people are very skeptical of the spending in Washington, coupled with all the spending that we've done over the last 7 months. And this heaping another $900 billion on to the American public is, I think he has a ways to go here, and I'm not sure that, it all adds up.
I'm glad you brought up skepticism, because I want to play something for the two of you last night. I think you guys know this better than we do, but I hit rewind about 5 times on my television last night to watch this. I was outraged. I want you to take a look and get your reaction.
The reforms I'm proposing would not apply to those who are here illegally. It's not true.
That was Congressman Wilson. He was heckling the president, calling him a liar. And I want to, first of all, tell you that the president, the White House, says that the president has accepted Congressman Wilson's apology. Many went out last night, Congressman Sestak, and said it was completely inappropriate and that he should apologize. He issued an apology immediately after. But what is your response to that? Was that appropriate, and especially in a joint session of Congress?
No, it wasn't appropriate, and Joe apologized, and I hope we now just move on. I will say this, however, that when I served for President Clinton as Director for Defense Policy, I came to recognize that there's the President and the Presidency. There is the congressional office and a congressman or woman. And when you besmirched the person, you besmirched, I think, the office. Perhaps this episode will have us all step back a moment in America, and even in our town halls, where many of us have been called liars, to sit back and say, you know, We ourselves as public officials need a better job of serving as public servants. But second, is due respect needs to be given to those offices and those who occupy it, because they are trying to do their best. My take on it, though, is Joe apologized. Let's move on.
Congressman Capito, you agree?
Well, I agree. I mean, Joe himself knows that it was very inappropriate for him to do something like that, and frankly is out of character. Joe Wilson is a very soft-spoken member of Congress, and I'm sure he's very regretful, but again, very inappropriate for him. I think, too, the president mentioned this in his speech, and it's something that we don't do enough of. We are I think we need to work towards civility in the House. We need to treat each other respectfully. And it's no wonder that we go out to town hall meetings and people call us names when we do the same thing on the floor of the House of Representatives. And I think we all need to take account of our behavior. But certainly for Joe Wilson to have an outburst like that last night was very inappropriate, and I'm sure very regretful. But I agree with Congressman Sestak. Let's just move on from this. He's apologized. The president, I'm sure, will accept his apology.
You know, what it suggests, as you both know, is tensions are very high and people are very nervous, particularly those who are worried about Medicare. Do you believe, both of you, as we wrap up here, that the president did what he needed to do in terms of his communication and clarity to the American people? Congressman Sestak, let's get your thoughts first.
I think he did, but that doesn't mean tomorrow we don't have to keep up the explanation of why this bill actually helps people in Medicare by closing the Medicare D prescription drug gap, the donut hole, so you don't have to pay $3,000 out of your own pocket, how it makes sure that for preventive care there's no co-payments. But we have to make sure, and to your other point, which I think Shelley brought up, understandable skepticism, the president has to keep true to his word, that presently we found the revenues and the efficiencies to pay for this. But there must be in this bill exact requirements that if those savings are not accrued, we will find them without adding to the national debt. I think that will help everyone also.
Let's hope that's possible. Congressman Capito, how did he do with the American people?
Well, I'd like to address seniors because the president specifically so in his speech last night, and there is a $500 billion Medicare cut in this bill, basically shelving the Medicare Advantage plan, where I have thousands of West Virginia seniors who are on this plan. And I think that, you know, wringing out waste, fraud, and abuse from Medicare is certainly something we need to do. But I think seniors are understandably concerned. Their retirements are not what they thought. Now they're looking at Medicare being shifted, and so I think this is an area that needs a lot of work. And Medicare is a program that serves a lot of our seniors, and they want to have the peace of mind that it's going to be there for them. Did the president give them that? Certainly he made an effort to do that, but again, we have, as Joe said, we need to keep re-emphasizing this.
All right, Congresswoman Capito and Congressman Sestak, thank you guys very much. Very reasoned conversation, and we appreciate it. All right.